Host. Hey, everyone. Welcome back to the CPR Business Mastery channel, your ultimate source for all things health and safety. Today, we're delving into a critical aspect of CPR that lays the foundation for effective intervention: checking for responsiveness. Whether you're a first-time viewer or a long-time subscriber, you're in for some valuable insights. Stick around as we explore the essential steps in determining responsiveness during a CPR session. Let's jump right in. Alright, folks, before we get into the nitty-gritty of chest compressions and rescue breaths, the first step is assessing for safety rather than checking for responsiveness. Is the person conscious? Can they respond to your voice or touch? It's a critical moment that sets the stage for the entire CPR process. So, if you're ready to boost your CPR know-how and gain confidence in assessing a person's responsiveness, hit that like button, subscribe if you haven't already, and let's dive into the crucial first step of any CPR session. Ready to make a difference? Let's do it together. Checking the responsiveness of an unconscious victim is a critical step in determining the need for emergency intervention. Follow these detailed steps. Ensure scene safety. Before approaching the victim, assess the surroundings for potential hazards and make sure the area is safe for both you and the victim. Look for any dangers, such as traffic, fire, or dangerous substances. Personal protective equipment, PPE. If available, consider using personal protective equipment, PPE, such as gloves to protect yourself from potential bodily fluids or contaminants, especially if the cause of the victim's condition is unknown. Approach the victim. Approach the unconscious victim cautiously, keeping in mind your safety and the safety of the victim. Look for any immediate signs of life, such as movement, breathing, or responsiveness. Check for responsiveness. Gentle tap and shout. Kneel down beside the victim to get a closer look. Gently tap the person on the shoulder and simultaneously speak loudly, asking, "Are you okay?" The purpose is to stimulate a response and assess the person's level of consciousness. Assess facial expression. While asking if the person is okay, observe their facial expression for any signs of responsiveness, such as eye movement, blinking, or a change in expression. Note any reactions that may indicate the person is aware of your presence and attempting to respond. Check for purposeful movement. Look for any purposeful movement, such as the person responding to the tap by moving their limbs or attempting to wake up. Lack of any purposeful movement may indicate a lack of responsiveness. Evaluate verbal response. Listen for any verbal response from the person. If they are able to speak or make sounds, it indicates a level of consciousness. Note the content of any verbal response, as it may provide information about the person's condition. No response. If there is no response to tapping, shouting, or any other external stimuli and the person remains unresponsive, it is crucial to consider them unconscious. Activate emergency services. Once it is established that the victim is unresponsive, immediately activate emergency services by calling 911 or your local emergency number. Provide the dispatcher with information about the victim's condition, and follow any instructions they give. Check for breathing. While waiting for emergency services, assess the victim's breathing. If the person is not breathing normally, or if you are uncertain, initiate CPR immediately. While waiting for emergency help and performing CPR if necessary, continuously monitor the victim's condition. Reassess responsiveness, breathing, and circulation regularly until professional help arrives. Remember, prompt action is crucial when dealing with an unconscious victim. The faster you can determine their responsiveness and initiate appropriate care, the better their chances of a positive outcome. Always prioritize your safety and the safety of the victim throughout the assessment and intervention process. Let's help save a life one victim at a time. See you in our next video, checking for a pulse. Thanks for watching.